The PCP, we hear that a lot in healthcare. So who is a PCP? What are the pros and cons of having one? And last, some tips to help you along. Welcome. I am the medical bill whisperer, a previous billing manager turned patient advocate. I offer insights, solutions, and answers to patients like you. So that PCP, it stands for Primary Care Physician. In the olden days, it was the family doctor or the general practitioner. The doctor you and your family would consult first with a medical issue, concern, symptom, or question. It is the doctor supervising your overall care and level of wellness. It is a doctor that can attend to everyday medical needs, meaning non-life-threatening, some things you would not call 911 for. A PCP is not what is called a specialist, so they deal with the whole body, not just a part of it. And depending on what state you live in, a PCP is usually a doctor, an MD, but can also be a DO, a nurse practitioner, a physician assistant, or even a clinical nurse specialist. For HMO members, and HMO being a kind of plan, you must have a PCP. The PCP is the doctor you must always consult first for any reason. And if that PCP cannot take care of that concern, he or she will refer you to a specialist for further care. For non-HMO members, meaning PPOs or EPOs, it is the doctor you can choose to have to consult for basic care, for advice, or for medical needs, such as minor health issues, general medical care, for example, your yearly visit, wellness screenings or advice, preventive care, management of your medications, centralized medical records, minor emergencies, and again, referrals to specialists. Let's get into more details. First, the pros. A PCP is basically centralized care. They are familiar with your case. They know what you suffer from. They are aware of what medication you take. And therefore, the medical care you receive is personalized. You usually would have a trusting relationship with them. And all of that means that they would need less resources, less tests, less labs to figure things out. If you call them and you're feeling under the weather, for example, if they know you are prone to having certain seasonal allergies, for example, they will not need to send you get a whole bunch of expensive tests in order to figure out what is happening. It is therefore affordable medical care and yes, the best value of a service you receive versus the cost you pay. That is why it has been pushed the last few years by insurance companies. You have incentive to use PCPs first because it saves money for your insurance, but also at the lowest copays, it saves you money. Another good reason is easy and varied access to care, not only through face-to-face visits in a doctor's office, but through teledoc, through a portal where you can upload documents, where you can ask questions, ask for refills, etc., or email address where you can contact your doctor directly. The staff can handle many of the tasks that may no longer require a face-to-face visit. For example, refilling a medication or asking for a referral for your yearly mammogram. Not seeing the doctor face-to-face saves you money. You don't need to pay a copay. And also, you don't need an authorization to see your PCP, saving you time. If you are pregnant, your OBGYN is considered a PCP. And if you have children, their pediatrician can also be considered a PCP. By switching from specialist to PCP status, you again save money. Now, of course, there are cons. The major one is the PCP's training and level of experience, expertise, or excellence. Often with an HMO, you may not even have the choice of a PCP, and subpar care has been an issue for HMO patients. Another reason is the PCP's decision authority may often not be theirs. What I mean is, if they are employee in a medical group or under the hospital umbrella or in a system like Kaiser, they may have very specific guidelines as to what they can treat, when a patient needs to be referred outside, or even whether they can refer a patient to an outside authority or specialty. If they get capitated money, meaning they get paid ahead of time, a monthly fee to take care of your services, and that income could be reduced every time you see a specialist, you can understand why getting to a specialist may be harder for you. Same if a PCP has a specific contract with your insurance, they also may be under contract to provide a certain range of services, regardless of whether you feel it's appropriate or not. For HMO patients, there have been over the years a number of complaints, and I mean a large number of complaints about PCPs obstructing access to specialists, again, because of contractual or financial considerations. Delayed access care to greater levels of medical services has been noted. The obligation to obtain referrals for any service outside of a PCP services also can take time and a lot of effort to obtain. If the PCP has decided or is being told that they can handle the level of care that you need, your referral to a specialist may be something of a fight. For non-HMO patients, the push by insurance companies to use PCPs has also been growing the past few years. Access to specialists is not restricted and does not require authorization. You may have noticed that more and more specialists are now out of network, especially those I call the super specialists, the pioneers for certain treatments, or the ones who only treat a very rare disease. Most of those, if not all, are out of network. If your PCP recommends a specialist, try and make sure that that specialist is in network. As for some tips, first, let's start with a disclaimer. Anytime you or a medical professional deem that medical care, whether emergency or not, is needed, please do seek it. Always call 911 in case of an emergency or mental health crisis. As for some tips, understand the scope of a level of care they can provide. Yes, preventive care can be done there. This is usually free to you, such as one physical a year, health assessments, immunization, screenings such as mammograms, etc. The treatment of common illnesses and conditions can also be rendered by your PCP. If you have an acute or chronic condition that is not life-threatening, if you need help with a lifestyle change or advice, small injury, not a fracture, but a sprain or muscle pain. Your PCP can also help with health screenings and early intervention in case something is not quite right on a test or a lab. Also, should new symptoms appear, your PCP can help evaluate them. For chronic conditions such as diabetes or COPD, obesity, or high blood pressure, for example, your PCP can manage and supervise any treatment or prescription regimen to keep your condition as stable as possible. Another tip is To take the practice of a PCP under consideration, for example, is the staff efficient? Can they respond to minor requests? Can they help refill a medication? Can they order a test or a screening for you? Or is the doctor the only one you must always go through? How easy is it to get a face-to-face appointment when needed? Does the office offer teledoc services? Can they handle minor services, for example, drawing of blood to send to the lab themselves, or do you have to go somewhere else to get it done? Another tip is always ask questions when you feel that the level of care is no longer sufficient at the PCP's office and needs to be referred to a specialist. For example, your tests are getting more and more complicated. Your condition is become more unstable. Intervention and treatment are either inefficient or harmful. Now is the time to get referred to a specialist. In conclusion, a good relationship with your PCP does lead to better care, but make sure that your PCP is someone who is listening to your needs, can address your concerns, and can help support your healthcare choices. I so thank you for watching, for the subscribe, likes, and comments that help this little channel grow. Thank you.